guys Hello guys, I'm going to start the video about the splenic spleen part 2. I will be discussing about the splenic artery and its all the branches which are going in the spleen. It will be a very it will be a very important video because there is the concept of red pulp and white pulp, which most of the students do not understand. I took the help of Dr. Najib videos to gain this concept and to simplify this concept, and some points are also added by me. So let's get started, guys. Now I will be making diagram of the spleen, and we know that in the spleen there is a hilum. Assume that this is the hilum of the spleen. This is the whole spleen. Okay, guys, in the hilum of the spleen, let me see where is the red pen, and I need one blue. Okay. So there will be one splenic artery. I will draw here splenic artery, and there will be one splenic vein. This will be the splenic vein, and there will be one lymphatics. There will be lymphatics, efferent lymphatics, and there is one concept of efferent lymphatics also. I will make you understand. This is the lymphatics, efferent. This is the splenic vein, and this is the splenic artery. Okay, guys, and this is I'm drawing the rough diagram of this spleen, and there are various in the capsule of the spleen there are various trabecules. These are known as the trabecules. They start from the capsule and they go till the inner layer of the spleen, that is known as parenchyma. So and there is the arteries. I was telling the arteries. I will show you how. Assume that this is the trabecule. Okay, one trabecule, and the arteries will be going inside of these. There are branches, and one branch of artery will be going inside this trabecule, and this will be known as trabecule arteries. There will be lots of trabecular arteries like this, and then this artery will again form branches like here. It will form branches, and this branch is called a central artery. This is called central artery for a reason. I will tell you why. This is the central artery. It has at its borderline it has various T cells present here. See, I will make with another pen. These are the T cells present. Okay, and they have a sheath. T cells have a sheath. You can do like this, and this sorry, and this sheath is called pals. P-A-L-S. Pals means periarterial lymphocyte sheath. Periarterial lymphocyte sheath. I will write here periarterial lymphocyte sheath. Then there will be a bulge like this of this artery, and here will be the B cells which will be accumulated here. B cells and T cells. We know B and T cells are they came from the primary lymphoid organs, like the primary lymphoid organ is the thymus, and there is one more I can't remember, and spleen is a secondary lymphoid organ. So these BNT lymphocytes, BNT cells settle here. BNT cells settle here, like I will show you. Okay, these are the BNT cells, and here the, if we make the cross section of this, like this is the T cells present, and here is the artery. The artery is in the center, so it is called, so that's why it is called central artery. But here the artery is peripheral. These are the T cells. Here is the artery. Artery moves towards one side because there is B cells present. This is the B cell, this is the artery, and these are the T cells. So it is also, here is also called, this is also called central artery. And then comes the branches of the central artery. Then I forgot to tell you one more features of tuberculi. They have myofibroblast cells, special cells known as myofibroblast. The function of myofibroblast is, I will write here, myofibroblast. As the name suggests, myo, it means muscle, so it has the contractile property. It also has one more thing which is very important and conceptual, that it has receptors for epinephrine and norepinephrine. In the stressful condition, these epinephrine and norepinephrine are stimulated, and they go in the spleen and they activate myofibroblast, and the myofibroblast contract and they give blood to the circulation. But it is not efficient in human beings, rather it is efficient in animals like dogs, as the sufficient amount of blood is provided in their circulation. So this was the one more feature of the trabeculae, that it has a myofibroblast. Okay guys, and one more thing about this lymphatic, that it only has efferent lymphatic, but it do not have afferent lymphatic, because the lymph which is formed, the lymph is formed in the spleen itself, so it does not need afferent lymphatic. It only need efferent lymphatic to transport the lymph from spleen to other organs or tissues. Okay guys, so this was the efferent lymphatic, and I told you about myofibroblast. Then we come to the capsule. This capsule hole, this is outer covering of spleen. It is made up of very dense connective tissue. Lots of collagen fibers are present. The spleen, the connective tissue, lots of collagen fibers are present. And I already told you about the dog thing. That is also very important. Then I have two theoretical lines which are very important. Thymus dependent part of lymph node. As we know that the T cells are present in the inner cortex of the lymphatics. So the T cells are produced by the thymus. So the T cells are also present here. You can see that T cells are present here, PALS here. So thymus dependent part of lymph node is inner cortex. We know that. And here thymus dependent part of spleen is PALS, around central artery. I already told you about the full form, periarterial lymphocyte sheath. Okay, and then comes the lymph node. This B cells, they are called the lymph nodes. They are in the active state. When they are in inactive state. The inactive state are, they are called lymph nodes. We know that antigen or microbe come and antigen antibody reaction occurs. When antigen comes, here is a lymph node. When antigen comes, antigen came, this lymph node gets converted into splenic nodule, which is very dangerous. The B cells gets accumulated so much here, they get stimulated and they destroy. B cells go and destroy the antigen producing cells, antigen secreting cell, we can say that. Okay guys, and this is also known as Malpighian nodule. Splenic nodule is known as Malpighian nodule, also known as Malpighian nodule. Spleen is spleen is filtering the blood for the antigens. Okay, so if in the I will show you how. So I will one more important came the concept of white pulp. This whole B and T lymphocytes are accumulated in this part, and this part is called white pulp, because when B and T cells they are stained a dark blue color, but they are known as white pulp. I don't know why. Then comes the already told you that plasma cells, which are present in the B cells, they secrete antibodies against antigen. Antigen came from here, went here, and they secreted antibodies. And when the B cells then migrate to the red pulp. Red pulp is over here. I will draw red pulp and secrete and antigen secreting cell, where antigen secreting cells are present, and these cells, B cells, destroy the antigen secreting cell. Okay guys, now this is the central artery. Now I will show you the branches of central artery. The central artery divides into various arterioles. I will make here arterioles. These are called peninsulary arterioles. Various branches. It goes in. It divides into various branches and form arterioles. If terminal arteriole, then there is a special concept here. I will make like here the diagram is like this. There are present splenic sinusoids, like the barrel shaped sinusoids are present. You can correlate with this, the barrel. These are called sinusoids, like here also sinusoids. This should be inside the spleen. Sorry for that. And between the sinusoids there are present splenic cord. I will tell you about these in the next page. And I will tell you at last that why these both are called the red pulp. Okay. So the terminal branches, terminal arterioles, that are known as like this is the one branch of the, and this is the second branch. I draw two branches. Okay. This is the central artery. These are the peninsulary arterioles. Then they divide into like this is the one branch. They were divided into two branches. Here is the, as already I mentioned, that Here is the splenic sinusoid. I will tell you the properties of splenic sinusoid, and here are the so these both are same sinusoids, and this is the cord. When terminal arterioles fall into the splenic sinusoid, this is called the closed circulation, and when the terminal arterioles fall into the splenic cord, this is known as open circulation. Okay guys, and so these all are called red pulp because they have blood all around them. The blood is falling here, it is going here and there, but the eventually the pathway from which the blood will go out of the spleen is this splenic sinusoid. It will go through the splenic sinusoid. So it is natural that the splenic cord should go from here to here. Then I will tell you about about their properties. The splenic sinusoid is made up of long endothelial cells and the basal laminar ring. These are the endothelial cells, specialized endothelial cells. These are basal laminar rings. Okay guys, and the splenic cord that is present here, this is made up of meshwork of connective tissue, and it also have one more thing, that reticulofibers. So the some blood will be going here and some will be going there, so they both have a lot of blood coming, so they are known as red pulp. Okay guys, red pulp is made up of splenic sinusoid and splenic cord. Then then I will tell you how the spleen destroy the injured or old RBCs. First of all, we have to know the properties of RBCs. RBCs are very flexible. I will draw one RBC. This is the RBC, and the RBCs are very flexible, and it has the protein known as glycoprotein, which make it so much elastic that it can move from one capillary to the another normally. And here are present macrophages. Here macrophages are present. When the blood moves from the open circulation to the closed circulation, the RBCs move like this, like they are moving very flexibly from here to there. If the RBCs are young, they will go from open to closed circulation very fastly, and without coming in contact with macrophages, they will easily pass from here, then go out in the circulation. But if the RBCs are abnormal, they are having some elastic problem, or they have become old, that in the old RBC the glycoprotein become denatured. When the RBCs is going here, they get captured by this one macrophage. And one more thing, macrophages are activated when there is hypoxia condition. In hypoxia condition, the lactic acid is produced, and the macrophages become so angry of that lactic acid that they tend to destroy the RBCs very quickly. So this is one of the stimulus of macrophages, that they get stimulated by the lactic acid. Okay, so this was the concept about the RBCs moving from one place to the another. Then when the RBCs are captured by these macrophages, what these macrophages do? Uh, these grab the hemoglobin out of the RBCs, and the two parts of one is the iron part and one is the bilirubin and biliverdin. We know eventually bilirubin and biliverdin will go into biliverdin. They will eventually become stercobilinogen and pass out through feces. Bilirubin will do this. Bilirubin, blood, liver, stercobilinogen. Okay. And the globin will form the amino acid because it is a protein. Three parts. No. This is not the part of hemoglobin. Yeah, this is the part of hemoglobin. Globin will form amino acid. Then comes the iron. What will be the fate of iron in the macrophages? In macrophages, iron will fuse with the apoferritin. When the macrophage detect that the iron can be harmful to itself, that is macrophages, it put a cap on iron, and that is apoferritin. It put a cap of apoferritin, fuse with the apoferritin and form ferritin. Then this ferritin gets accumulated in the macrophage in the form of hemosiderin. Okay guys, so this was the fate of hemoglobin. Then comes there is one more important area, the marginal area. I will show you. Here is the marginal area. This is the marginal area. This is present between the red pulp and white pulp. Here is present the marginal area. Lymphocytes leave circulatory system and settle into target area of white pulp. So lymphocyte leave from circulation and settle into target area of white pulp. So there are important features of this marginal area. I will show you, tell you each and everything. One function is the immune responses are generated in the marginal area. Immune responses are generated in the marginal area. Okay. So marginal area is very rich in antigen presenting cell. Antigen presenting cells, also known as what was the name of the antigen presenting cell? Dendritic cell. Marginal zone very rich in antigen presenting cell, that is dendritic cells. From the marginal zone, lymphocyte leave the circulation and settle in the target area, as I have already told. Lymphocyte leave the circulation and settle in the target area of white pulp. Then the last thing of today's video will be the functions of spleen. No, it will be the second last. After that we will be doing the diseases related to the spleen. Then I will divide it into two. This is the immunological function and this is the hematological. As the name suggests, you are very well smart to know what is the difference. This is the white pulp where B cells and T cells are concentrated. This is the red pulp. where RBCs are present. WBCs are also present, platelets are also present. This is the antigen presenting cell. That is dendritic cell, and this is the housing T cells and B cells. This is housing T cells and B cells. And another feature is helps in initiation of immune response. This obviously helps in initiation of immune response, as I have already told you about the B cells. This is the function of B cell. Helps in initiation of immune response. Then is the against the antigen. We know that against the antigen. It also provides antibodies as against antigen. It provides antibodies and removal of abnormal macromolecules. Removal of abnormal macromolecules. And here comes the hematological functions of spleen. This is called as red pulp, and it helps in the removal of old or abnormal RBCs. Removal of old or abnormal RBCs. It removal of iron from the dying RBC. This is done by the macrophages. I have already told you about the fate of iron from dying RBC. Then the storage of blood in animals. And there is one more important feature of spleen in the infant life, that in fetal life spleen act as hematopoietic organ, production of RBCs. Fetal life spleen act as hematopoietic organ. And now we will discuss about the diseases or the diseases. We'll be doing the clinical now. Clinical of spleen. When there is too much bleeding from the spleen, there is the trauma. The blood fastly flows from the spleen to the other organs. Then the doctors do spleenectomy. That is the removal of spleen. The things which are observed after the splenectomy is the substances in RBCs. In substances in RBCs, Howell Jolly bodies are observed. Substances in RBCs, Howell Jolly bodies. These Howell Jolly bodies are to be eliminated by the macrophages in the spleen. So when the RBCs pass from the spleen, the RBCs do not pass from the spleen after the splenectomy. So the Howell Jolly's bodies are viewed in the RBCs. These are nothing but the accumulation of chromatin in RBCs. Accumulation of chromatin. The RBCs, the macrophages eat the chromatin from the RBCs when they are passing from the spleen. So the accumulation of chromatin occurs. So these are called Howell Jolly's body. The splenectomy. The splenectomy is fatal in children, as in children early age splenectomy there is bacterial infection. This bacterial infection occurs these bacterial infection occur for a reason, because these are the capsulated bacteria. I will tell you what are the capsulated bacteria. Bacterial infections post splenectomy. So the bacteria like Neisseria meningitis, Streptococcus pneumonia, and Haemophilus influenza. These all are capsulated bacteria. Capsulated bacteria. The to destroy these bacteria, we have the macrophages in the spleen, but after the splenectomy, these bacteria do not filter in the spleen and result in the infection. So there is one more clinical I will tell you. There is the what is that? Let me see. Yes, portal hypertension. The portal hypertension. I will tell you what is this. This is the mesentery vein. This is the splenic vein, and this is the portal vein. This is coming from the spleen. This is coming from the mesentery, and this is the liver. Okay, this is the liver. It has the sinusoids, and these open into the inferior vena cava. No. Yes, inferior vena cava. These after these sinusoids, these open into the inferior vena cava. So when there is cirrhosis of the liver occurs, there is one point where cirrhosis of the liver occurs. There are various things which cause the cirrhosis of liver. Nodules, that is the nodules in the liver. So this sinusoidal, this is disturbed. The sinusoidal branches are disturbed due to the nodules. So the blood is not passed actively. So the blood starts accumulating here. This blood, deoxygenated blood, puts pressure on the splenic vein, and this vein, the blood started accumulating inside, and this becomes enlarged. So this enlarged spleen is called septicemia, I think. Let me check. What is it called? Not sure. Is it septicemia or what? Wait a second. Checking. Enlarged spleen. Yes, it is called splenomegaly. I'm sorry guys, this is called splenomegaly. I was having a doubt in this. So the enlarged spleen is called splenomegaly, and this is the another clinical. Cirrhosis of liver causes the splenomegaly of the spleen. And there is one syndrome. This is called known as Felty syndrome. And one more point I would like to add, that the spleen has the calcium and iron coats on the capsule of the spleen. These are called Gandhi gumna. These are called Gandhi gumna. These are in chronic congestion. Chronic congestion. Chronic congested. Gandhi gumna, chronic congested. And there comes another syndrome called Felty syndrome. This also causes the splenomegaly, rheumatoid arthritis, that is the joint pain in joint, and the neutropenia. that is the count of the neutrophils decreases. I will write here what are the features: splenomegaly, rheumatoid arthritis, neuro, what was that, neutropenia. These are the white blood cells. Granular neutropenia, that is the decrease in cells, neutropenia cells. Thank you guys. So this was all about the spleen. Now let's see what we have to cover in the next videos. I have covered each and everything of the spleen, its gross anatomy, its physiology in the arterial supply. It's all done, and this clinical is also done. So let's see what we have to do in the next video. Thank you guys for watching.